Teenage pregnancies in South Africa jumped up by 60% during the COVID-19 pandemic in the Gauteng province. The phenomenon has raised serious concerns for the well-being of both the mothers and the babies. New figures from the Gauteng Department of Health show that more than 23,000 girls aged under 18 gave birth between April 2020 and March this year. What is worrying for most is the fact that 934 of the new mothers are aged under 14 compared to 14,577 girls aged 19 and under having babies in the same period. Earlier, I discussed this with the nutrition thematic manager at the Save the Children, Marumo Sekgobela.
One would say there are a couple of factors that contribute towards this trend. And if you look at it and also you compare with the period in which these statistics that we are reflecting on today speaks to, this is speaking to the Gauteng statistics of the financial year 2020-2021. And this is the period in which the country for the first time experienced COVID-19 lockdown. Now, what are the factors that one can look at? One, we're looking at closure of schools in general or intermittent attendance to schools. Reason being, we all know that for a fact that schools does provide a protective environment for our young ones, our adolescents and young children. When they are in school, they are mostly protected. But then in this time period that we are reflecting on, most of the time they were at home and not in school. Secondly, one could also look at the access to the primary healthcare facilities within the country. We are aware that during the COVID-19 lockdown, as when it began, most of the efforts were put to prepare for the unknown in terms of the large scale of outbreak for the pandemic. And as a result, our young people were not having the access that they normally used to in order to go and make proper consultation within the primary health care facilities. Unfortunately, that did not stop them from also engaging in sexual activities, as most of them were already sexually active. Now, one could also look at the role that parents have played in general, because when you look at this report, most of these children, I'm afraid to say, they felt pregnant under the watch of the parents. So this actually exposed the role that parents play in the upbringing of their own children. And one would also say children were simply stressed. And perhaps one way of relieving that stress was to engage in sexual activities, because they found themselves not going to school, being trapped at home, not interacting with their peers, and the results is what we are seeing today.
Mr. Sekgobela, is this taking place only in Gauteng, or is it a trend across all provinces of the country?
First of all, I would like to acknowledge and thank the Gauteng Department of Health for making this public for all of us. Mm-hmm. I want to believe that as much as we are reflecting on the statistics that we have seen coming out of Gauteng, this could be a trend that is observed countrywide. Yeah. And I would also want to challenge other provincial health departments to make these statistics available so that we could look at the picture countrywide to say what has actually happened. But indeed, in my view, this is something that could be happening in the entire country.
Now, Save the Children has expressed concern about the well-being of both teenage mothers and their babies. So what is it exactly that you're concerned about specifically?
Well, as you have said, 934 of these babies are between the ages of 10 and 14. And this for us is shocking. The first concern is that babies are having babies. And that should really challenge anyone in society, that a 10-year-old or even a 14-year-old having a baby is really something that we should be concerned about. Now, secondly, how are these babies themselves, who have had babies, unfortunately, going to bring up these children? Because the challenge now is they themselves need to be taken care of, and in return, they must also take care of the young one that, unfortunately, they are having. So that is a challenge. And the other challenge that we will see is that most of them are likely to drop out of school and never return. And we know the outcomes of children dropping out of school at this early age would be dire in the near future. And also, we know that, when the young ones are having babies, there are definitely going to be the health effects to that, Premature babies, and some of the babies are likely not to make it later in life, failure to thrive, and issues that also come with, giving birth at the early age in life, while you are also the mother still at the stages of developmental. So those are the challenges and the concerns that we are looking at as Save the Children South Africa.
And which sections of the Gauteng community, perhaps, is this trend prevalent? As we know that, there is the poor informal dwellers, there is the black township middle class, and as well as the affluent suburbs as well.
At this stage, since we are interacting with a report that came about 2 weeks ago, I'm not privy to the exact areas, but safe to say that the Gauteng Department of Health would be better positioned to share the mostly affected areas. But one would not rule out the possibilities that in situations like this, you would find that the informal settlement and as well as the farming communities are the mostly affected.
Right.
So one would really need to go down and get to understand exactly in which part and areas of Gauteng. But definitely, you would find that the situation in informal settlements and our farming communities are the ones that are hard hit, as it happens even with most of the challenges that society experiences.
I suppose we're quite cognizant to the fact that early pregnancy and motherhood is known to perpetuate poverty, illiteracy, and even forced into early marriages. So what needs to be done to break this cycle?
Look, I think it's about time that everyone is involved. I mean, ourselves, all parents should be involved. Society should be involved. The religious leaders should be involved, as well as the traditional leadership. We must make sure that government, as well as civil society organizations, intensify what we call the comprehensive sexuality education, the interventions that are aimed at this age group that are happening in schools, to make sure that our young people are actually taught on issues of sexuality at an appropriate age while they are still developing, so that they get to know what happens later in life. They get to know what happens at every stage of their development, so that you don't get a situation like this where a 10-year-old is pregnant and does not even know it. Unfortunately, this is what we are faced with. So indeed, let's make sure that as civil society organizations, everyone involved, as government, let's intensify all our comprehensive sexuality education interventions and other interventions that are meant to assist our young people to grow well and get to be fully clued around what is happening in their development.
Mm-hmm. And you've also warned that the global pandemic risks being a time of irreversible setbacks and lost progress for girls. So what are some of the risks associated with the COVID-19 pandemic?
Look, I've already said it. One of the things is that we will see more children dropping out of school. Mm-hmm. And chances are that some of them might never go back to school. One would also look at the devastating effect of COVID-19, because here we are faced with the reality of loss of parents, loss of guardians for the children that we're talking about, and therefore, who will be there to take care of these children? Who will be there to provide guidance to these children? There's also psychosocial effects, psychological effects that unfortunately would go a very long way as a result of the effects of COVID-19. So one is looking at a future that is challenging, a future that will really challenge our young people as they develop and grow, because of loss of parents and loss of guardians, and also total disorientation on what is happening with them right now.
Dr. Sekgobela, what can society as a whole do to empower teenage girls in terms of preventing unintended pregnancies? And in the same breath, to what extent do you think that cultural nuances play a role insofar as preventing, teenage pregnancies? Because there's this principle of it takes a village to raise a child. Just to what extent does that work?
Absolutely. I mean, as a parent, I'm actually shameful that, like I have said, most of these children fell pregnant under our own watch because they were not going to school as usual. Therefore, as society, we all have a critical role to play. It starts with the parent of the children. Make sure that we engage our children as early as possible. When they enter into puberty, let us explain what is happening around in their body developments. Let us explain to them what will follow next. Yes. Let us explain to them such that as they grow, they get to understand all stages of their development. Communities, these children fell pregnant within communities. As you have correctly said, it takes the whole village to raise a child.
Yes.
Let's make sure that still our neighbor's child is still my child.
Yes.
So that the things that we see happening, we are able to address them while time still allow. Yes, you also mentioned the critical factor of the religious leadership. Our religious society should also come on board and make sure that they are able to educate our children, because they are fortunate. Children do listen to them, as well as the traditional leadership. Our traditional leaders, equally like the religious leaders, they've got the advantage because our children do listen to them. So let's make sure that we instill all those social norms and values in our children, but let's not forget to engage them about the issues of sexuality education, because it's a reality. We need to teach them about this, but then we teach them what is age appropriate. We're not saying we are going to be haphazard about it. Let's make sure that our approach is age appropriate, such that by the time they move out of puberty, by the time they move out of early adolescence into late adolescence, already they know. In that way, I want to believe that as society as a whole, we will win for the benefits of our children and indeed the future of our country, South Africa.
And just speaking about the different approaches to sexual education, what are some of the key factors contributing to the sexual and reproductive health risks that adolescents face in South Africa?
There are definitely a number of key factors, and I'm going to put them in this way. One, the major factor is judgmental attitudes. And the judgmental attitudes towards our adolescents come in twofold. One, from community members themselves, the parents. If a young person was to go to a clinic today at the age of 12 or at the age of 13 or even 14, parents are the first ones to judge this young person. What are you doing here? Because a clinic is not for young people. Secondly, the judgmental attitude, unfortunately, is displayed from some of our very own, healthcare professionals that are supposed to provide healthcare to young people. They get to interrogate our young people when they visit clinics instead of giving them the relevant information that they are looking for. So those are some of the challenges. The other challenge is access to the primary healthcare facilities themselves. You find that young people within communities have got fear of visiting a clinic. Now, the moment they have a fear of visiting the clinic because of other factors that are at play, then we have a problem. And eventually, the other factor would be availability of services themselves. Young people can find themselves within a clinic, but then you find that the range of services that they are supposed to receive from the very same clinic are not available. Just to make it practical, a young person goes to the clinic and opts for this method of contraception, only to find that they are out of stock, and they've been out of stock for long. They don't even know when that will be available. So those are some of the challenges. Those are some of the barriers that we have in our young people accessing a comprehensive package of sexual reproductive health services.